Good afternoon. The Senate Subcommittee on Public Education will come to order. Let's take roll call, please.
Senator Howell, Senator Locke, Senator Donovan, Senator Peake, Senator Hashmi,
Here.
Senator Lucas. Madam Chair, you have a quorum.
Thank you. The first bill that we have today is HB 1736, patroned by Delegate Adams, and I believe Delegate Adams is here to present the bill.
Yes, ma'am, Madam Chair. Can you hear me okay?
Yes.
Thank you. Madam Chair, members of the committee, HB 1736 makes it clear that when we refer to a school nurse in our public schools, we're referring to a registered nurse. This bill is definitional, but extremely important. This bill does not preclude others from providing health services in designated school health centers. It simply states that they may not call themselves a school nurse. The reason for designating registered nurses as school nurses comes from the regulatory authority, education, and experience of registered nurses. Registered nurses possess post-secondary education in nursing, and by law, only registered nurses can make professional nursing assessments. This is essential when students with complex chronic conditions such as diabetes type 1 and asthma require in-school professional health advice, guidance, and treatment. Additionally, the school nurse is often the first line of assessment for children experiencing an acute health situation. Registered nurses possess the assessment skills to determine whether a child needs further evaluation. To be clear, this bill would not require schools to employ RNs. The school superintendents and school board associations have stated that not all schools are able to hire RNs at this time because of funding and the healthcare workforce shortages. But this bill will provide the much needed transparency for who is delivering school health services. Perhaps one might think, who cares? A nurse is a nurse. But that would be a gross misunderstanding of the different scopes of practice delineated in state law. RNs are independent practitioners. LPNs, on the other hand, must work under a RN or a physician. RNs are the only school nurses who can evaluate a student in crisis and then respond based on that assessment. A parent or an LPN would instead have to call 911 or a RN in another school unless they needed life-saving intervention like CPR. Another reason to care is that more and more kids are getting their only healthcare in schools, especially in rural and underserved areas. Our parents and teachers really need to know who is treating their kids. This bill is supported by the Virginia Education Association, the Virginia Parent Teacher Association, and the Virginia Association of School Nurses. This definition of school nurses as registered nurses is the first step towards encouraging a discussion among school administrators, teachers, and parents about who provides health services in our schools. Thank you, Madam Chair.
Thank you, Delegate. Are there any comments or questions from committee members? Is there anyone who wishes to speak either for or against the bill?
Madam Chair, we have two speakers in the queue. First is Becky Bowers.
Yes, Ms. Bowers. Ms. Bowers, are you still on the line?
Sorry, I was trying to get my video and audio on. Madam Chairman, members of the committee, I'm really not the best person to speak to the school nurses, and I believe my president is here. I represent the Virginia Association of School Nurses. To sort of paraphrase what Delegate Adams said, we have no intention of requiring schools to redeploy people who are working in school health centers and school clinics. However, we do believe that it's important for transparency purposes for parents and children to know who it is that is humaning the school health centers. Thank you.
Next is Shane.
Madam Chair, thank you. This is Shane Riddle with the Virginia Education Association. Becky said that very well. Just wanted to let the committee members know that we support the bill in its current posture and appreciate that committee forward. Thank you.
And the final member of the public with their hand raised is Jenna Alexander.
Good morning. Thank you. On behalf of Virginia PTA's 175,000 members, I want to share our strong support for HB 1736. Right now, there's no defined standard for who provides health services in our schools. So it's imperative that our parents understand, particularly those that have children with chronic health concerns or who are struggling with health and safety aspects of returning to in-person instruction, the types of qualifications that the staff have that are overseeing student health in their school. Registered nurses uniquely provide support for physical, mental, and behavioral health concerns, are essential for infectious disease surveillance, health screenings, and immunization compliance. And for many of our children living in or near poverty, the school nurse is the only healthcare professional that they access regularly. We urge you to pass HB 1736. Thank you.
There are no other hands raised, Madam Chair.
Thank you. Are there any questions or comments from committee? Is there a motion from the committee?
Chairman, I do have a question.
Yes, Senator.
And this is for the patron from my district. That our district, which we overlap a little bit, has shared with me that they have 25, and maybe I missed this, I kept having people giving me proxies, but 25 of their smallest elementary schools are staffed with LPNs because that's what they have available and what they have funding for at this time. And so how does this affect the schools that currently have LPNs? Is there a delayed enactment? Can they not count that as a nurse? How is this going to affect what's already happening in Virginia, I guess, is the question.
Thank you, Senator. Is the patron still on?
Yeah. Thank you, Madam Chair, and thank you, Senator, for that question. This does not affect anything related to hiring. It does not affect anything related to the current status of Henrico or other counties. They may still have their same staff that they have today. It simply would require them to pick a different title. So it could be, many schools are doing this already, such as a school health aide, or you could even call them an LPN. But they cannot be called the school nurse, and it essentially makes very clear that that title is reserved for the skills associated with a registered nurse.
Thank you. Are there any other questions or comments?
Just a follow-up, Madam Chairman, and I'm literally articulating
Senator.
from my district, and they say that because the medical community refers to LPNs as licensed practical nurses, and they've made a commitment to having nurses in all their schools, this does create a problem for them. And I think it's something that we have to think about a transition and how these schools, this is really above and beyond because we know across the state not all schools have nurses. And some of them have the LPNs, and I think it does affect the communities, especially in their efforts to try and make sure that they have staffed appropriately. So I'm going to at least have to abstain on this until I figure out if they have a suggestion of how to move forward. And I'm curious why we need to do this right now when we don't have the funding to staff registered nurses.
Thank you, Senator. Does the patron wish to respond?
Certainly. Thank you, Madam Chair. So again, this is not about changing the staffing ratios. This is about establishing, the first tier of a structure that will address the many concerns that kids are manifesting in schools today. We are in the midst of a pandemic. We are in a midst of a society where our food supply is not a real food supply. We're more sedentary than ever. We are seeing kids with more chronic health conditions than ever before. And we are going to continuously need to improve the protocols and the expectations and the skill levels of the healthcare provided in our schools, just by virtue of the fact that the entire infrastructure of our education and healthcare system is a very complicated one, but doesn't often intersect. Registered nurses provide these unique skills that will allow us to scale that type of competency and care over time. And so this bill is just an incremental step to establish a baseline for what does it mean to be a school nurse. It has absolutely nothing to do with any type of hiring or reshuffling of people. They may still hire LPNs, they may still hire school aides, but it is establishing that first step in a process to ensure that we know what a school nurse is, and we know that the other person who is not a school nurse could be a parent, could be a volunteer, could be an LPN, but they're still not the registered nurse. Therefore, they're not the school nurse. It's an incremental step in a larger to address a larger problem. Thank you, Madam Chair.
Thank you, Delegate. If there's no other comments or questions, is there a motion?
I would move to recommend reporting. Second.
It's been moved and seconded. All in favor. Are we doing a roll call, or can we use our desk devices?
Voice, Madam Chair.
Thank you. Let's go to vote.
Senator Howell? Aye. Senator Locke? Senator Donovan? Senator Peake by proxy? Senator Hashmi?
Yes.
Senator Lucas? Yes, ma'am. Ayes 3, noes 2.
Thank you. The bill is reported. Thank you, Delegate Adams.
Thank you, Madam Chairwoman.
Our next bill is HB 1823, patroned by Delegate Askew. Is Delegate Askew available to speak to the bill?
Yes, I am, Madam Chair.
Please go ahead, Delegate.
Thank you, Madam Chair. Madam Chair, members of the committee, HB 1823 requires that each building that was built before 2015 that houses any public school classroom for students, licensed child day programs, or other programs that serve preschool age children to be equipped with at least one carbon monoxide detector. Madam Chair, the current code only requires buildings built in 2015 and beyond to have said detectors. We filed this bill because there was a situation that happened last year in Virginia Beach where there was a leak occurred at a daycare facility, and we're doing everything we can to stop that and happening in the future. Thank you, Madam Chair.
Thank you. Are there any questions or comments on the floor? Is there any member of the public who wishes to speak for or against this measure?
Madam Chair, we have one member of the public, Nikki Zellner.
Please go ahead.
Thank you, committee. Thank you, Madam Chair. On the morning of February 20th, carbon monoxide began to poison close to 100 students and teachers at a state-licensed, nationally accredited daycare in Virginia Beach, Virginia. The daycare opened at 6:30 that morning. The first symptoms of CO poisoning began to occur around 9 a.m. Increased symptoms appeared between 10 a.m. and lunchtime, and due to inclement weather outdoors, the children and staff remained in this building with progressing symptoms. A teacher at the school who was the only one who had taken a voluntary first aid course asked her husband to bring in a detector. At 2:10 p.m., it alerted. 5 hours after the first symptoms of carbon monoxide poisoning showed. The reason they did not have carbon monoxide detection on site, even though they had fuel-fired appliances, they were not required by the state of Virginia to do so. My 2 children were carried out to an ambulance, confused, dizzy, poisoned, lips blue. Another child was unconscious, and many teachers were treated at local hospitals. At first, I was mortified, and then I felt extreme guilt as a parent that I did not know this was an issue, not only in my school, but in 2,000 other schools across the state of Virginia. I dove deep into research and realized it is our building code that requires legislative change in order to mandate that protection of carbon monoxide is on site. Right now, our school systems are not equipped with training that allows teachers to understand how to discover symptoms of carbon monoxide. They don't understand where carbon monoxide detectors may or may not be in their building. They don't understand how carbon monoxide is made as a byproduct of combustion. And they do not understand, and many of our administrators do not understand, that you do not have to have fuel-fired equipment and gas systems on site to have carbon monoxide-related incidents in schools. Since I began researching, I found 89 public press-related instances of carbon monoxide poisoning in schools. Out of those 89, 25 were related to non-gas systems. They were related to things like idling vehicles in the car pickup line, delivery vehicles dropping off things near the cafeteria, sewage lines being replaced outside of the building, construction and landscaping crews using diesel-related equipment while students.
Thank you. If you could summarize in just 30 more seconds, that would be helpful. Thank you.
So everyone might understand the word carbon monoxide. Many do not understand how it is a serious risk to our students and our teachers. The only way to be alerted to carbon monoxide in a school building is with a detector. Many of our school systems are aging. Out of 2,000, over 50% are over 50 years old in the state of Virginia. It's my recommendation we put carbon monoxide detectors on site until we can do a thorough review of what each school system may need individually based on the condition of their school.
Thank you so much for your testimony, and thank you for your advocacy. I appreciate you sharing what must have been a very, very traumatic experience for your family, and I hope your family is all well. Are there any questions from committee members? Is there a motion on the floor? Let's take a roll call of votes.
Senator Howell, Senator Locke, Senator Donovan, Senator Peake, by proxy, Senator Hashmi.
Aye.
Ayes 5, no 0.
Delegate Askew, thank you. Your bill is reported.
Thank you, Madam Chair.
Thank you.
Our next bill is HB 1838, patroned by Delegate Reed. Is Delegate Reed available?
Yes, Madam Chair, I'm here.
Thank you. Please go ahead.
Thank you, Madam Chair, members of the subcommittee. House Bill 1838 would allow the Loudoun County School Board the option to implement a staggered election cycle for their school board terms. This is not a new concept. In 2011, the General Assembly granted counties a one-time option to move to staggered terms. While 57 other counties at that time chose to do the staggered option, Loudoun County did not choose to exercise it at that time. And then in light of recent election in 2019, Loudoun County School Board saw 7 new school board members elected, which brought this back to the desire for them to be able to have an option to move to staggered terms. Specifically in addressing this legislation, it would not in any way affect the current members. It would move towards having 5 of the 9 members elected in the next election cycle to be staggered, and those would be drawn by lot, and it would only be done after the school board actually took election to determine that this is the way that they wanted to move forward. So, Madam Chair, members of the subcommittee, this is effectively providing the Loudoun County School Board with an option to move forward with having staggered school boards terms for 5 of their 9 members.
Thank you very much. Are there any questions or comments from the members? Is there anyone from the public wishing to testify?
There is not, Madam Chair.
Is there a motion on the floor? It's been moved and seconded. Let's take vote.
Senator Howell, Senator Locke, Senator Donovan, Senator Peake by proxy, Senator Hashmi.
Aye.
Ayes 5, no 0.
Thank you, Delegate. Your bill has been reported.
Thank you, Madam Chair. Thank you, members of the subcommittee.
Our next bill is HB 1865, patroned by Delegate Delaney. Is Delegate Delaney available?
I'm here, Madam Chair. Can you hear me?
Yes, please go ahead.
All right. Thank you, Madam Chair. Thank you, committee. The bill before you strengthens the code to require that reading intervention services provided to students in grades K through 3 be evidence-based. The bill also strengthens the code to require notification to parents or guardians that reading intervention services are being given to their children, as well as notification on the process that the child makes during the course of those services. As students are identified as needing literacy intervention, the code requires some form of intervention in the minimum of 2.5 hours. However, there are no clarifications for instructions for how that child should be taught. The parents are not informed of the intervention measures and therefore unaware of any potential progress or issues that their child may be experiencing. If the student does receive the intervention and continues to fall behind in their reading performance, the parents or legal guardians are still not informed of the status of the process their child is making. The current method of assessing and providing intervention for students that have been identified as needing help has proven to be ineffective in creating lasting academic success. The lack of structure and support within the Code of Virginia allows students to fall through the cracks and ultimately fall behind in their academic studies. In the academic school year of 2014 to 2015, the students who were identified for intervention measures in the spring of their first grade year, 26% of those students met the spring second grade benchmark, which leaves 74% of those same identified students not meeting their spring second grade benchmark scores. This means that 74% of students that were flagged for intervention and received intervention measures still did not meet the required benchmark scores needed. The Code of Virginia does not provide enough information or guidance for the volunteers and trained professionals to effectively assist those students that require additional instruction and reading intervention. So the solution that I bring before you is establishing and supporting structured requirements for the tools that should be used when conducting literacy instruction and intervention will ensure that we are providing the best intervention services to our children, including parents, and the measures and steps taken on ensuring academic success of vulnerable students is vital to increasing their success benchmark scores and maximize parental involvement and support. Making those necessary changes establishes accountability and effective practices that are the standard across the Commonwealth of Virginia. This legislation is essential to ensuring that every student has a fair chance to be academically successful.
Thank you, Delegate. Are there any questions or comments from the floor? If not, I have just a quick question, Delegate Delaney. I know last year we saw a similar bill, and there was some disagreement between our folks in the Reading Association and the folks representing Decoding Dyslexia. Is there peace in the Valley now on this particular bill?
So I know I believe we have some representatives from Decoding Dyslexia that might wish to testify. We did hear some concerns on the original version of this bill that we did take into account in the House. And so the bill before you now has taken into account the concerns that were raised to ensure that the language is simply focusing on that evidence-based practice while still giving flexibility to the schools to serve students who have a diverse set of needs.
Thank you. Are there folks waiting to testify then?
Yes, Madam Chair, there are several members of the public in the queue.
If we could take those who support the measure first, and I'm going to ask that comments in total be restricted to 5 minutes. If you are speaking in support of the measure, be conscientious of the fact that there are others behind you waiting to speak, and so please limit your comments. 5 minutes total for those who support the bill.
First, we have Shane Riddle.
Madam Chair, this is Shane Riddle with the VEA. Our legislative committee did not have a position on this bill in the House, but the legislative committee has since moved to support the bill. And so we encourage the committee to do the same. Thank you.
Next is Shannon Duncan.
Good afternoon. My name is Shannon Duncan, and I'm a member of Decoding Dyslexia Virginia. In broad strokes, this bill helps to align early intervention for struggling readers with the science of reading. It is in direct support of Superintendent James Lane's vision for a 7-step plan to improve literacy instruction in Virginia by enhancing awareness of the science of reading for all learners and aligning policy with instructional practice. If it had been in place 12 years ago, my daughter may have received the early intervention she needed to learn to read. Please vote yea at every opportunity you have to help this bill become a law, and thank you for the opportunity to speak in favor of HB 1865.
Rebecca Warner, please go ahead.
Thank you, Madam Chair and members of the subcommittee. I am a founding member of Decoding Dyslexia Virginia, and I've been an advocate for over 10 years. My son had this sort of impact in the school, he would have been successful. And I know that many of the parents I've spoken to would have also had a drastically been improved situation. I ask for your support for HB 1865. Thank you.
Abigail Johnson, please unmute and go ahead.
Good afternoon. My name is Abby Johnson, and I am honored to be the current 2020 Teacher of the Year for Spotsylvania County Public Schools. I am here to represent my students, past and present, and those yet to come. I encourage you to vote yay on HB 1865 in favor of the students in our public school classrooms that are identified as struggling readers. Do you realize that over 60% of our very own Virginia students are not reading on a proficient reading level, as reported on the nation's report card? HB 1865 would be a bill that would help ensure that all students are provided an equitable opportunity to receive interventions that are research-based and provided at the earliest onset of difficulty. Parents deserve to know if their child is struggling to read and that proper interventions are in place to monitor that progress. I have taught at the elementary level for 13 years, and as of this year have switched to the high school level so that I can observe and intervene in the literacy area at the secondary level. So many students did not receive the interventions they deserved and required.
I believe we have quite a few speakers, and we really appreciate your endorsement of this bill. Thank you.
Thank you.
Next is Jenna Alexander.
Good afternoon. On behalf of Virginia PTA, we want to voice our strong support for HB 1865. We know that many school districts and therefore teachers use balanced literacy or whole language approaches to teach students to read. Unfortunately, these methods are often ineffective for dyslexic students and struggling readers. Superintendent Lane has already laid out a comprehensive reading program based on the science of reading, and your passage of HB 1865 will help improve academic outcomes for struggling students and provide inclusive communication for parents. Thank you.
Madam Chair, there are no other hands raised.
Thank you. Are there any questions or comments from the floor? Is there a motion?
Move to recommend reporting.
Let's take a vote, please.
Senator Howell, Senator Locke, Senator Donovan, Senator Peake by proxy, Senator Hashmi.
Aye.
Ayes 5, no 0.
Thank you, Delegate. Your bill is reported.
Thank you, Madam Chair. Thank you, committee. Have a great day.
And thank you. I have a quick question for our clerk. I have HB 1909 coming up next, but this is patroned by Delegate Subramaniam, not by Delegate Reed. Am I correct on that?
I believe
Gave me
so.
indicated
Yes,
that it was Reed, but it's actually Delegate Subramaniam.
Yes, ma'am.
Thank you. So the next bill is HB 1909, and is the delegate available?
Madam Chair, can you hear me?
Yes, thank you. Please go ahead.
Thank you, Madam Chair, members of the committee. HB 1909 is a local option to allow school boards to make their own policies regarding firearms on property they own or lease. As you may know, during the last session, this body passed legislation that allowed localities to prohibit firearms in buildings they own or use for government purposes, but that bill did not address buildings owned or leased by school boards. And that's becoming an issue for some school boards like ours here in Loudoun County that want to hold meetings in their own administrative buildings, but cannot regulate firearms in their own buildings. This bill simply asks that if a school board owns or leases a property, it has a local option to set policies related to firearms. I look forward to your questions and hope we'll be able to body this subcommittee to support this legislation. Thank you.
Thank you, Delegate. Are there any questions or comments for the patron? Is there anyone who wishes to speak?
Yes, Madam Chair, we have several speakers in the queue.
I will ask those who are in favor or support the bill to raise their hand, and please limit your comments in total as a group to 5 minutes. We will hear those who support the bill for a total of 5 minutes, those who oppose the bill for a total of 5 minutes. Please go ahead.
First, we have Melanie. Please go ahead. Melanie Cornelise.
Thank you. Yes, I'm Melanie Cornelise, and I'm a proud member of Moms Demand Action for Gun Sense in Virginia. And I'm also a co-founder of Chesapeake's School Safety Coalition. And we urge you to vote yes on House Bill 1909 to extend the gun ban from school property to all properties that are owned or leased by the school board. Thank you.
Next is Lori Has. Lori, please go ahead and unmute.
Good afternoon, Madam Chairman, members of the committee. My name is Lori Haas. I'm with the Coalition to Stop Gun Violence, and we support the bill. Clearly, it was the intention of this body when it gave local authority bill that passed in 2020 that this areas were not caught up in that original bill. So this bill makes a lot of sense. We already know that properties and school campuses are prohibited from firearms in those situations, but these giving local school boards the authority to regulate firearms in those other places that they own or lease makes the utmost sense for the safety of our children. We support the bill. Thank you.
Next is Andrew Goddard. Please go ahead.
Thank you, Madam Chair, members of the committee. We support, I speak for Virginia Center for Public Safety. We support this bill. No matter what you might hear from other people, the occurrence of injury and death in locations where people are prevented from having firearms is much lower than in places where firearms are not regulated. We believe that school boards should have the opportunity of making their meetings gun-free. Thank you.
Atusa Reeser, whenever you're ready.
Good afternoon, Madam Chairwoman and members of the committee. My name is Atusa Reeser. I am the Vice Chair of the Loudoun County School Board. On behalf of the board and the school division, Subramanian for introducing House Bill 1909, where it passed on a bipartisan vote with 55 colleagues in support. The ability to exercise the local option for school buildings is important to us because of our students. Our board includes students in our regular board meetings. Student school board members sit on the dais with us. We showcase them in presentations on the floor, and they participate by giving comment and watching proceedings as part of their social studies classes and Boy and Girl Scout requirements. Of course, you'll remember that during the 2020 regular session, you passed legislation that authorized localities to decide whether firearms could be carried into their buildings. In Loudoun County, our school board owns buildings which would not be covered even if our Board of Supervisors exercises that local option. In addition, our board does not meet at a school like other neighboring school districts, so we are also not covered by school gun-free zone laws. So it seems we were inadvertently omitted from what the General Assembly may have intended to cover last year, and we ask the committee to support this legislation to give local school boards the same authority that our neighboring school divisions and county boards have. Thank you.
Tom Smith.
Madam Chair, members of the subcommittee, this is Tom Smith with the Superintendent's Association. And just real briefly, we're in support of the bill and appreciate the delegate for bringing it forward. Thank you.
Shane Riddle.
Madam Chair, this is Shane Riddle. The VEA supports HB 1909. Thank you.
Madam Chair, there are no other hands raised.
Is there anyone that wishes to speak in opposition? And again, please limit your comments. A total of 5 minutes will be allotted for those who wish to speak in opposition.
If you could digitally raise your hand in the Zoom call if you would like to speak in opposition. Madam Chair, there are no hands raised.
Is there a motion on the floor?
Move to recommend reporting.
It's been recommended to report and seconded. Let's do a roll call vote.
Senator Howell? Aye. Senator Locke? Senator Donovan? Senator Peake by proxy? Senator Hashmi?
Aye.
Ayes 4, noes 1.
Thank you, Delegate. Your bill is reported.
Thank you, Madam Chair.
And if Delegate Rome would just indulge me for a second, I received a request from Delegate Bulova to speak on HB 2105 since he has a committee to chair shortly. So if we could do HB 2105, that would be wonderful. And is Delegate Bulova available?
Yes, thank you, Madam Chair. Can you hear me okay?
Yes, please go ahead.
Right. Thank you, Madam Chair and members of the committee. Members may recall last year we passed legislation sponsored by me and also Senator Howell that did two things. It consolidated state coordination of our early childhood education programs and also created a quality rating and improvement system for our publicly funded early childhood programs. That consolidation is on track. Likewise, the Board of Education is on track to adopt its quality rating system by this July. What this bill does is two things. First, it delays the requirement for publicly funded programs to participate in that quality rating system from 2023 to 2024. The pandemic has obviously made it a little bit more difficult to implement the necessary training in order to be able to get those educators familiar with those standards. And so what this does is it has 2023 as a dry run as part of the training program, and then actual implementation would occur in 2024. The second thing this does is it extends and refocuses the existing school readiness committee. And so this committee was absolutely essential with respect to setting the stage for adopting the changes that we made last year and was actually going to expire at the end of this year. However, there is a real need to examine how early childhood education can be made more affordable and also making sure that our providers are paid enough to provide stability to the system. And so as a result, what the bill does is it removes the expiration date for that group and then focuses the committee's attention on those issues. Thank you, Madam Chair. That's what the bill does. This was brought to us by the administration. And so I think we have David Carey, the Assistant Secretary of Early Education, who can answer any technical questions, but I appreciate your consideration.
Thank you very much, Delegate. Are there any questions or comments from members? Is there anyone from the public who wishes to speak either for or against?
Yes, Madam Chair, we have Shane Riddle. Once again, please go ahead, Shane.
Yeah, well, quickly, Madam Chair, the BEA supports Representative Bullock's bill 2105. Thank you.
If there are no other speakers, is there a motion on the floor?
Move to recommend reporting.
It's been moved and seconded. Let's do a vote.
Senator Howell, Senator Locke, Senator Donovan, Senator Peake by proxy, Senator Hashmi.
Aye.
Ayes 5, no 0.
Thank you, Delegate Bulova. Your bill has reported.
Thank you so much. Appreciate your time.
Thank you. And our next bill is HB 2013, patroned by Delegate Rome. Delegate Rome.
I'm here, Madam Chair. Ready when you are.
Please go ahead.
Thank you, Madam Chair, and thank you to the members of the committee. HB 2013 would prohibit school boards from filing a lawsuit against a student or the student's parent because the student cannot pay for a meal at school or owes school meal debt. During a global pandemic where 1 in 4 children live in families experiencing food insecurity, it is necessary now to eliminate actions that could punish parents and students in court for school meal debt when they are already experiencing unprecedented financial challenges. Currently, at least 27 Virginia school divisions have school meal policies that either threaten the use of legal action or state the policy to take definite action against families to recoup costs of school meal debt. In the 13th district and other areas of the Commonwealth, many Black, Latinx, and other families of color are disproportionately targeted by school meal debt shaming mechanisms or for not being able to pay for a school meal for any reason. Now, we know there are other mechanisms that schools and school districts could take care of other than legal action in court because a family doesn't have money. And that includes, like what we passed this past year, by when we unanimously passed my bill HB 5113 to require participation in the community eligibility provision, which requires eligible schools to actually, take up these federal dollars in the first place, so that we can eliminate, school meal debt wherever you have those eligible schools. We also know that by passing one of my other bills last year, HB 703, where we are allowing school boards to solicit and receive donations from the community in order to pay off school meal debt. And so basically, we know we have other mechanisms that are in place where we can avoid having to send parents to court or a student, an 18-year-old student to court simply because they were hungry. And so with that, I'll be happy to answer any questions.
Thank you, Delegate. Are there any questions or comments from members? Is there anyone from the public that wishes to speak?
Yes, Madam Chair, we have a few members of the public with their hands raised. They're being moved into the room right now.
If you are speaking in support of the bill, please limit your comments in total for 5 minutes. So please go ahead.
First, we have Kenneth Gilliam.
Good afternoon, Senator Hashmi and members of the subcommittee. My name is Kenneth Gilliam. I serve as the policy director for New Virginia Majority, and we strongly support this bill. We believe that this bill builds on the work that the General Assembly has already done, particularly last session, to not shame or stigmatize children and their families due to their inability to pay. And so for those reasons, we strongly support the bill. Thank you all for your time.
Tom Smith, please unmute and go ahead.
Madam Chair, I'm speaking with some concerns about the bill, so if somebody else wants to go ahead.
Next, we have Adele Settle.
Hi, my name is Adele Settle, and I founded a nonprofit called Settle the Debt that pays down the lunch debts of Prince William County schools. I'm here to speak in strong support of HB 2013 because lunch shaming any child is wrong, and there are better ways to treat Virginia families who are in need. I hear from parents regularly about why they've been unable to pay off their child's meal debts, and it's usually due to job losses or tragedy. These families need help, not a lawsuit. Instead, I encourage those school districts to utilize charities like mine in order to address this cost. Through public-private partnerships, schools can recoup the costs and ensure children and families are not facing this extraordinary hardship, especially now in light of the additional economic hardships placed on families during and following the pandemic. I urge you to pass HB 2013. Thank you.
Samora Ward.
Hi, my name is Samora Ward, and I'm the lead organizer at Virginia Block. I'm here on behalf of my organization and our membership to ask you to vote yes to this bill. We've been organizing around this issue for more than 3 years, and even before the pandemic, we've seen families fall into an eligibility gap where they make too much to qualify for free or reduced price lunch, but not enough to cover the cost of school meals. We know that this pandemic and its economic repercussions will only exacerbate this problem, leaving even more families burdened with school meal debt. As we've organized, we've also fundraised over $9,000 to pay off school meal debts. And at no point during our fundraising campaign have we ever been able to pay off the debt of an entire school. That was before a global pandemic. We strongly believe that now is the time to take action to address the growing problem of student hunger and school meal debt. Families are struggling and they need your help. So Virginia Block urges you to vote yes to this bill. Thank you.
Jenna Alexander.
Good afternoon. On behalf of Virginia PTA, we want to voice our strong support for HB 2013. Prior to the onset of the current public health crisis, approximately 850,000 Virginians were food insecure, including 250,000 children. An estimated 445,000 additional Virginians are experiencing food insecurity as a result of COVID-19. We know that children are not effective learners when they're hungry, and it's imperative that we continue to break down barriers and stigma that deter students from participating in our school meal programs. We urge you to pass HB 2013. Thank you.
Salam Badi.
Good afternoon, Madam Chair, members of the committee. My name is Salam Bhatti, staff attorney at the Virginia Poverty Law Center. Echoing what everybody else has said, I co-sign everything they've said, and I thank the delegate for bringing this bill. In the interest of it being near to Valentine's Day, I wrote a short poem about this bill. Roses are red, violets are blue. When a child can't pay for a meal, it doesn't mean we should sue. Please support this bill. Thank you.
Thank you for the poetry, Salon.
Next is Shane Riddle.
Madam Chair, committee members, the VEA supports Delegate Rome's bill, HB 2013, and we urge the committee to pass it. Thank you.
Stacy Haney, please unmute and go ahead.
Madam Chair, I also have concerns, so if you could move me to speak after Dr. Smith, I'd appreciate that.
Madam Chair, there are no other hands raised in support of the bill.
Thank you. If we can hear from those who oppose the bill.
Tom Smith, please go ahead.
Madam Chair, Tom Smith with the Superintendent's Association again. we've had concerns about this bill. First off, let me be very frank. Children are being fed. Schools are providing thousands and thousands of meals, particularly during the COVID crisis, in part because some of these costs are being picked up by the federal government and the U.S. Department of Agriculture. School debt is a real issue. Schools work very hard with families who owe them debt. They sign them up for free and reduced lunch. We're not talking about those families. We're talking about families that can pay for it, that don't for one reason or another. They also try to work out payments with those families that do that. So when in an informal survey looking at school year 18-19, with a little over half of the school divisions reporting, the amount of school debt was in excess of 1.3 million. That's a lot of funds that schools will have to take in and provide some sort of means of paying for if this bill passes. Now, we understand the sentiment behind it. We understand that the likelihood of it passing, and as such, offered an amendment to the delegate, which if school division has tried in many of the ways that she has sponsored, has tried to collect debt but cannot, then they can make application through the Board of Education to the Literary Fund to receive that amount. And we capped this at $250,000 per year per school division. And we felt the way that probably both issues talked about in this bill and both sets of issues could be handled. Also made some sense, as I'm sure you know, the Literary Fund is provided through fines and tickets. So people who are committing crimes would help feed children in that way. Unfortunately, the delegate decided not to include that amendment. And so if this passes, we would like that amendment added. Thank you.
Madam Chairman, question for the speaker.
Please go ahead, Senator.
Thank you. Tom, I'm just curious, the amount of money that you just mentioned, the 1.2 million, if I'm remembering correctly, are you saying that is for school debt not of children that qualify for free and reduced lunch, or is that for all children, including those that qualify for free and reduced lunch?
No, ma'am, it's for those school divisions who were not able to collect that debt. So it's uncollectible debt. They tried and they couldn't do it. You got to remember, in some of these school divisions, one rural school division that contacted me, the debt was $23,000. Now that may not seem like for a big school system, but that's the cost of an instructional aide. And so they're going to have to make cuts somewhere if they cannot receive these funds. Cafeterias are set up as supposed to be self-sustaining, but this debt is a burden on a lot of these school divisions. That's why we offered the amendment.
Madam Chairman, follow-up question.
Madam Chair.
Please go ahead, Senator.
What I'm trying to figure out is that I have a request for my school division that is articulating a similar concern, and their proposal is that this bill be limited to that 42% of kids in Virginia that qualify for free and reduced lunch, because that's where we have the food insecurity. So we're obviously we all want to help with food insecurity. We when somebody can't pay, we still want their children to eat. So I'm trying to determine if the debt that you're talking about is, if that includes those children, or if that is a whole attribution of debt that is only for those kids who do not qualify for free and reduced lunch, because that's two separate problems. I'm trying to figure out if that number, if you know, does it include free and reduced lunch or not?
It was the total amount of debt. When I asked about solutions, school divisions indicated that if they had a parent that did owe debt, then they tried to get them signed up for free and reduced lunch if they qualified. And so it could be that there's some wasn't there, but I think the majority of that child's costs are borne through the free and reduced lunch program.
Senator, are those all your questions?
Madam Chairman, I'll wait until after all the speakers. Yes, ma'am.
Thank you. I believe we have one more speaker, Ms. Haney.
Yes, Madam Chair, thank you. Stacy Beanie on behalf of the Virginia School Boards Association. I would just like to speak, to echo Dr. Smith's comments and to speak in support of the substitute that he's proposed. And I know he shared it with the delegate and all the members of the subcommittee. And to address the question that Senator Donovan asked, I believe the figures for school debt do not include students who qualify for free lunch because they get free lunch, therefore they don't incur the debt. So these are the debt is for the students who are not on free lunch. But the amendment that Dr. Smith has proposed is really a win-win because it gets what the delegate wants, which is school divisions won't be suing parents for school debt, which frankly would be a last resort for us as well. But it gets what the delegate wants in that lawsuits wouldn't be filed. But it also enables school divisions to recoup the money from the literary fund so that we can keep our school lunch programs afloat and don't have to cut from other places to cover that debt. So it really is a win-win, Madam Chair. And so we would ask that you look favorably on that proposed amendment because it would really help the school divisions out. And I don't think it does any harm to what the delegate wants to do, which is prevent these lawsuits. And so I would just ask that you look upon that amendment shared with you. Thank you very much,
Madam Chair.
I believe Senator Donovan wanted to address the questions, and then we'll certainly hear from you again, Delegate.
Madam Chair, I think my concern is that this opens up the potential for abuse because if people never have to pay their debt, even if they have means, the school, it doesn't look like there's any interim alternatives. Suing is an extraordinary one, but can they send them to collections? You know, what can they do? And so I think we all agree on the obvious problem, which is those families without means should never be shamed, and we want to support them and help them and make sure those kids are nurtured so they can learn. But I am not sure that this bill accommodates the other situations that happen, and it's putting the schools at a disadvantage, and none of us want abuse of generosity either. So I don't know that we're getting to a happy solution between those two extremes.
Thank you, Senator. And Delegate Rome, do you wish to respond?
Yes, I do. Thank you very much, Madam Chair. So the first thing I'll do just to respond to Dr. Smith is my team reached out directly to Dr. Smith in the run-up to us even before we even filed the bill. And we asked for feedback. We asked for suggested text changes, edits, anything that, Dr. Smith or, basically the association wanted to bring to our attention. The only response we received was, we are going to oppose this bill. We did not receive any constructive criticism or constructive feedback before we filed the bill. And then the bill went through subcommittee, it went through full committee, it went through the House. And now that it came here, we just got that substitute, in which I responded in an email to, basically saying like, look, so now only because we got the bill out of the House is something even coming up in the first place, where that should have been happening out of professional courtesy that my staff extended. That should have been happening considerably earlier in the process, which is basically the point of me declining that. At the same time, I will certainly abide by the will of the committee. The second thing here is just to respond to one of the questions that Senator Donovan raised. First off, reduced priced meal students are in fact included in the school meal debts. And so in Prince William County, for example, we knew that prior to COVID and prior to the USDA waiver extension, that basically means that right now we have those universal free school meals, which is the ultimate goal here. We know that about 15% of our school meal debt was coming from reduced price applications. And so, or, people who were on reduced price meals. Now, and the other thing that Senator Donovan mentioned was basically what other alternatives are there to, prevent, abuse in this case. Well, I would also mention to the committee here that the committee last year approved my bill, HB 1426, where we mandate participation in the federal breakfast and school lunch programs. And section B of that bill says, and I quote, "Nothing in this section shall be construed to limit the ability of a school board to collect payment for meals provided pursuant to subsection A, provided, however, that no such school board shall utilize a non-governmental third-party debt collector to collect on such debt." That basically means that they can collect that in-house. They can use their own debt collector system. And so while my ultimate goal is universal school meals so that we don't even have to have the concept of school meal debt in the first place, I would suggest that number one, during a pandemic right now, this is a great time for creative solutions for, looking forward, because you're not dealing with that issue of school meal debt in the current year right now. And the second thing that I would also recommend here is that because we are establishing this, we are building off of existing precedent that we have already done before. And I think one of the, I really think that when we are trying to eliminate the idea of school meal debt shaming, which is legislation that we have passed in this body on multiple occasions, including one of my bills last year and a bill in 2018 from Delegate Hope, that what more form of school meal shaming is there than to drag a child or their parent before a judge so that they can actually have a court-ordered conviction against them because they couldn't afford something. And so that is the heart and soul of what this bill is meant to do. So are there other mechanisms like enrolling in CEP, for example, where these eligible schools, that these 27 schools that are actually have this policy in the first place, if they want to prevent school meal debt, then go enroll in CEP. That's the bill that we passed that has that mandated requirement, HB 5113 from last year that passed unanimously. So that's already one of the things that's on the book that is an alternative to suing. And the last thing I would mention is this also means that we've got about 105 school divisions across the Commonwealth that don't sue their students or the parents of those students, including in Prince William County, where we have the second largest population in the state. And we have found other ways to to deal with this rather than a lawsuit.
Thank you, Delegate. I think we've heard testimony both for and against. Is there a motion or a motion on the floor? We have a motion to move to report, and it's been seconded. Let's do a roll call vote.
Senator Howell, Senator Locke, Senator Donovan, Senator Peake by proxy, Senator Hashmi.
Aye.
Ayes 4, noes 0, abstentions 1.
Thank you. And Delegate Rome, your bill has reported. And Delegate Rome, I know that you have another bill, HB 2135. Let's go ahead and do that one.
Great. Thank you so much, Madam Chair, and thank you to the members of the committee. HB 2135 increases school participation in the federal USDA Child Adult Care Food Program's after-school meal program in order to provide federally reimbursable meals and snacks, as well as educational and enrichment programs to students 18 and younger in low-income areas after school. There is an urgent need to increase school participation in the program due to growing student food insecurity and the increasing learning gap among students exacerbated more than ever during the pandemic. And one of the things I really want to highlight here, why are we carrying this? Based on VDOE data from 2019, which was the last school year before the pandemic, only 281 out of 936 eligible schools participated in the after-school meal program, which 655 schools that are eligible, which is approximately 70% of all the eligible schools here, did not participate in the after-school meals program, leaving valuable federal resources for low-income children and their families on the table and unused. It pays to serve after-school meals. Many eligible schools with existing programs that currently provide meals and snacks but don't participate and receive federal funding through the after-school meals program can be reimbursed and use the money previously spent on food to serve additional children, offer more educational enrichment programs, or hire additional staff. Under the after-school meals program, a portion of federal funding for participating schools can be directly used to support administrative costs. In the limited circumstance where it may not be financially viable for a school to participate in the program, and keep in mind, the program is designed for it to be financially viable in the first place, these concerns can be addressed through the financial viability waiver included in the legislation and administered by VDOE, who can work with any school or school division to assist with applying, participating, or evaluating the program. And with that, I would just note that that waiver is based on the existing precedent from HB 5113 that we passed last year that I mentioned during my last bill presentation, where basically, even though the program's designed to be financially viable, if for some reason it wasn't for a locality due to a reimbursement rate issue, VDOE would be able to issue that waiver to take care of them. So with that, Madam Chair, I'm happy to answer any questions.
Thank you. Are there any questions from committee? Any comments from committee?
I'm sorry, point of clarification.
Please go ahead, Senator.
I'm so sorry. Did I hear you correctly? Because I was reading some concerns for my district that if a district had a local program that was more financially beneficial, they could receive a waiver from the Department of Education. Did I hear that correctly?
So, Madam Chair, what I would tell the senator here is that if it was not financially viable for that, for that locality to base or for that school board to be participating in it, that they would be receiving that waiver. We also would note in the language here that we want to encourage you. If you have this successful after-school meal program already, please, by all means, continue doing that. And they will be able to continue doing so. However, what I want to, really, get at here is that we don't have those enrichment programs everywhere at these schools. And at the same time, we are leaving a lot of money on the table coming in from the federal government to be able to take care of these kids. So that's the goal here.
So, Madam Chairman, follow up.
Yes, Senator.
So it is permissive for schools, for school divisions, if they have a successful program, to be waived out of this requirement.
So, Madam Chair, what I would like to do here is, if it's okay, I just want to read from the actual bill text where it says, nothing in this section shall be construed to prohibit any school in the local school division from applying to the department to participate in the program if that school offers after-school meal programs that, 1, provide organized and regularly scheduled after-school activities for children after school or on the weekends, holidays, or breaks during the regular school year. 2, include educational or enrichment activities such as arts and crafts, computer lessons, or homework assistance. And 3, are located in an area that meets eligibility requirements for participation in the program pursuant to FNS guidelines. So I certainly hope that helps. And the other in section D, where it says, nothing in this section shall be construed to prohibit any school in the local school division from partnering with agencies or organizations that participate in the program, which partnership may include sponsoring at-risk after-school care centers that operate at the school or at a location outside of the school that already participate in the program to satisfy the requirements set forth in subsection B. So I would certainly hope that those two sections address the senator's concerns from her locality.
Thank you. Are there any other questions, Senator Donovan? Do we have any members who wish to speak for or against?
Madam Chair, we have several members of the public in the queue.
I would ask if you have already spoken to the delegates' previous bill in support of that bill, if you would just state your name, your organization, and express your support. That will help us. If you're in support of the bill, please raise your hand.
First, we have Mark Hickman.
Yes, thank you, Madam Chair, members of the subcommittee. Mark Hickman on behalf of the School Nutrition Association of Virginia, which supports HB 2135 to strengthen access to nutritious meals for Virginia school children. Very briefly, we also thank the patron and the stakeholders for working together to make participation in the program more practical, including the ability to collaborate with community partners, as Delegate Rowe mentioned, the waiver process, and the delayed enactment date. We urge you to vote yes on this bill. Thank you for your time.
Shane Riddle.
Thank you, Madam Chair, committee members. The VEA Legislative Committee has taken a position to support HB 2135. Thank you.
Jenna Alexander.
Hello, Virginia PTA would like to reiterate our support for programs that reduce student hunger in support of HB 2135. Thank you.
Adele Settle.
My name is Adele Settle. I'm the founder of Settle the Debt, and I'm here to urge you to pass HB 2315. Thank you very much.
JT Kessler.
I'll be speaking in opposition.
Samora Ward.
Greetings, Samora Ward, Virginia Block, the Virginia Black Leadership Organizing Collaborative. And on behalf of our members, we urge you to vote yes to this bill and make sure that young people aren't going hungry when there's something that could be done to prevent it.
Adam Russo.
Good afternoon. Thank you, Madam Chair. I am Adam Russo, the Director for the Office of School Food Nutrition Services for Prince William County Public Schools. We are the second largest operation in the Commonwealth, the 30th largest in the country, and a practitioner of our programs. We receive $0 from school boards for our operations. We are completely reimbursed as revenue for sales. That pays for our employees, equipment, all supplies to furnish yummy meals for scholars so that they may be prepared to learn. Economies of scale are really, really important in our business. And so the more opportunity we have to provide more meals with the existing labor force that we have is a benefit to our program from an efficiency standpoint. In Prince William County, we have an effective partnership with our after-school facilitators that provide before and after care, and we provide meals for them, similar to what the question was from a member of the Senate. And that partnership is very strong. We have 56 locations who are eligible, and of those, we'll have 49 that would participate had it not been for COVID. Right now, everyone is feeding. But again, as a practitioner, our programs rely on economies of scale, and this provides that to us by having the opportunity to provide more meals. Further, as an educator first, our goal is to nourish their bodies so that the classrooms may nourish their minds. This gives us that opportunity to capture those students, give them the nourishment they need to be successful within school. Thank you for.
Kenneth Gilliam.
Good afternoon again, Madam Chair, members of the subcommittee. I'm Kenneth Gilliam with New Virginia Majority, and we strongly support this bill.
Salam Bati.
Salam Bhatti, Public Benefits Attorney at the Virginia Poverty Law Center. We support this bill.
Madam Chair, there are no other members of the public in support of the bill.
Thank you. If there's any who wish to speak in opposition, please go ahead.
JT Kessler.
Good afternoon, Madam Chair, members of the committee. Excuse me, JT Kessler on behalf of the Virginia School Boards Association. We oppose this bill on a couple grounds. This is the third, if this bill passes, it'll be the third piece of mandated legislation for an optional federal program. And we believe that local school boards are the best suited to decide what programs they participate in, and also to decide whether their schools or divisions are financially viable and not the superintendent of public instruction. Thank you.
Madam Chair, there are no other members of the public in the queue.
Thank you. If there are no other questions or comments from the members, is there a motion on the floor?
Move to recommend reporting.
It's been moved to report and seconded, and let's do a roll call vote.
Senator Howell, Senator Locke, Senator Donovan, Senator Peake by proxy, Senator Hashmi.
Aye.
Ayes 3, noes 1, abstentions 1.
Thank you, Delegate. Your bill has been reported.
Thank you very much, Madam Chair, and to members of the committee.
Thank you. We are going to do HB 2305. This bill was referred from our full committee this morning, full committee on education and health. So let's go ahead and do HB 2305, and that is with Delegate Tyler. Delegate Tyler, are you on?
I am here, Madam Chair.
Please go ahead.
Thank you. House Bill 2305 is before the committee at the request of the Secretary of Education. This bill charges the Board of Education to include identifying best practices to ensure Virginia government schools maintain accessible pipeline in preparation, effective communication, strategies for attracting a diverse range of prospective students, and robust diversity, equity, and inclusion programming. The Board of Education will work with relevant stakeholders that would include local region school boards, regional government school boards, and other groups as they develop the guidance. Madam Chair, there was a work group over the summer of 2020 that included Secretary of Education, governor, school administrators, senators, delegates, alumni, school superintendent, and the Board of Education. And basically the mission of the work group was to determine what could be done to enhance diversity, equity, and inclusion at all government schools, focusing on creating a middle school pipeline for underserved and underrepresented students. I hope the committee would pass the bill, and I also have the Secretary of Education to speak to the bill at the appropriate time.
Thank you. Are there any questions or comments from the members on the floor?
Madam Chair, I have a question.
Please go ahead.
Delegate Tyler, you mentioned the work group. Is this legislation coming out of the work group as a recommendation?
Yes, Senator Locke. It was bigger in scope initially, but with much conversation and redrafting the bill, this is the final draft of the legislation.
Are there any additional questions or comments from the floor? Hearing none, if we have any who wish to speak in favor of the bill, and I believe Secretary is on the line, as mentioned by Delegate Tyler. If the Secretary wishes to speak, please go ahead.
Thank you, Madam Chair. Thank you, members of the committee. Just here to show strong support from the administration on behalf of the bill, and thanking Delegate Tyler for carrying the bill. I'll be on standby because I know there's a lot of speakers lined up to answer any questions that the members might have. Thank you.
Thank you. If all those who wish to speak in favor of the bill will please raise their hand, we'll admit them into the room. And we're going to limit comments to 5 minutes. 5 minutes total for those who wish to speak in favor of the bill. Please go ahead.
First, we have Sukung O.
Hi, Senator Hashmi and members of the subcommittee. I'll keep my statements here short because we have so many other great students. We actually have some students here to testify. I just wanted to share, as a representative of Nacosec, Virginia, a Asian American organization based in Northern Virginia, we strongly support this bill. There was some controversial comments made on the House side describing this bill as anti-Asian and anti-immigrant. And we're here to say very clearly that we do not think that that is the case, and that the motive for talking about governor schools is because they're publicly financed, yet their student bodies clearly show the under-enrollment of Black, Latino, and economically disadvantaged students. And so that consequently, this is not about attacking Asian American communities, and that Asian Americans don't claim any entire portion of seats at these schools in any case. So we support this bill. Thank you.
Next is George Tarico.
Good afternoon, Chairwoman Hashmi and members of the subcommittee. I'm Jorge Tarico, the Applicant Outreach Chair for the TJ Alumni Action Group. I was a low-income, undocumented Latinx graduate of the Governor's School, better known as TJ. My wife and I are homeowners in Burke, naturalized immigrants from South Korea and Bolivia. We are UVA graduates, parents of 3 sons in Fairfax. I'm here in support of HB 2305, sponsored by Delegate Tyler. I encourage the Virginia Senate to support it, adding a positive chapter to a continued history of our Commonwealth. A history that includes 10 years of massive resistance to desegregation after the 1954 Brown v. Board of Education ruling, and the practice of naming school after school for Confederate slave owners, including my son's elementary school in 1989. This bill has 21 short lines of what should be a bipartisan commitment to chip away at the infamous history by directing the Board of Education to issue guidance that the excellent public education we are so proud of should be accessible to all. Thank you.
Emily Figley, please go ahead.
Good afternoon, Chairwoman Hashmi and members of the subcommittee. My name is Emily Figley, and I'm speaking on behalf of both the Maggie Walker Alumni for Racial Justice, as well as Chesterfield County NAACP, to share our support of HB 2305. We believe that this bill is an important step in enhancing accessibility, inclusion, and equity within governor schools. For decades now, the admissions practices at many governor schools have perpetuated vast racial inequalities. At my own alma mater, Maggie Walker in Richmond, only 3% of the incoming freshmen this year were Black, despite almost 30% of the Richmond metro area residents being Black. As public schools that receive state funding, governor schools should be accessible to all highly motivated and high-achieving students, regardless of income level, race, zip code, or how early they entered the gifted pipeline. This legislation will give governor schools the support they need at the state level to create a more inclusive and equitable education experience for students who are historically underserved, as well as other students who attend these schools. Please vote in favor of HB 2305. Thank you.
Next, we have Dinan El-Sid.
Hi, my name is Anil Sayad. I am a senior at Thomas Jefferson High School for Science and Technology. You might know that my school lacks diversity. It's 1.7% Black, and I've dealt with racism during all my 4 years at TJ. This year alone, my teacher called me an angry woman when I wrote about racism, and that same teacher accused me of over-exaggerating the struggle of being Black at TJ because apparently my skin isn't that dark. It's funny that she says that because the racism I've received over the years has made me hate my hair, try to bleach my skin, and question whether I was good enough for TJ. I've experienced racism at the hands of teachers and other students at my school and believe that TJ and other governor schools desperately need to become more diverse, inclusive, equitable, and culturally responsive spaces. I hope that you vote in favor of this bill. My time is running out as a student at TJ, but this bill would make the future of Black and Brown kids all across the Commonwealth a little bit brighter. Thank you.
Thank you. Do we have many more speakers in support of the bill?
Madam Chair, we have one more speaker.
Thank you. If you will just restrict your comments to about 30 seconds, that would be wonderful.
Shane Riddle.
Thank you, Madam Chair. I'll be really quick. Not only does the VEA Legislative Committee support HB 2305, but our own Fitz-Turner Commission also supports this bill, and we would appreciate the committee moving it forward. Thank you.
Thank you, Mr. Riddle. And just like with those who support the bill, I'm going to limit those who are opposed to the bill to 5 minutes. Please go ahead.
There are no other hands raised, Madam Chair.
Nobody is speaking in opposition to the bill. Are there any questions or comments from members on the floor?
Madam Chair?
Yes, please go ahead.
I just want to mention that I was a part of the work group that met weekly that talked about this issue and visiting and talking about the governor's schools and the lack of diversity at each of the governor's schools. So I heartily endorse this legislation and move that it be recommended for reporting.
We have a recommendation to report, and it's been seconded. And I just want to, before we take the roll call, echo the words of Senator Locke. And I deeply appreciate actually all of the emails that I've received from, in particular, the alumni and the students who are from Maggie Walker, our local governor's school here in Richmond. Many of them have expressed very strong support for this legislation. Let's do a roll call vote.
Madam Chairman.
Yes, Senator, please go ahead.
I am going to abstain on this. I am surprised that we do not have anybody speaking against this bill because I have gotten a lot of calls and information that make it not exactly the presentation we've seen today from the speakers we've had, and that there's a lot of concern about this and the process. And so I'm going to abstain on this bill because I think as we go forward, there may be more input. Thank you, Madam Chairman.
Thank you, Senator. Did you wish to speak on behalf of the folks who contacted you and share their concerns?
I won't. It's always awkward to speak secondhand, but I will let them voice for themselves. I'm just not quite sure why they're not here, but thank you so much.
Thank you, Senator. Let's go to the roll call vote.
Senator Howell, Senator Locke, Senator Donovan, Senator Peake by proxy, Senator Hashmi.
Aye.
Ayes 3, noes 1, abstentions 1.
Thank you, Delegate Tyler. The bill is reported.
Thank you, Madam Chair.
And we have had a request from Delegate Corey because she has another committee to run to. So we will move to HB 2238. HB 2238. Delegate Corey, please go ahead.
Thank you. I need to mute myself in the other meeting. Sorry.
If I could, Delegate Weber, if we could do it.
I appreciate your taking me out of order, Chairman. And I present HB 2238, which I'm bringing on behalf of the Department of Education. HB 2238 deals with the fact that currently the Board of Education monitors private schools for students with disabilities through a licensure process, which is focused on student health and safety only. Schools are fully reviewed only every 3 years. The bill that I'm bringing forward adds academic accreditation for private schools for students with disabilities to the existing required safety standards. HB 2238 ensures that high academic standards promoting positive outcomes for students with disabilities will be implemented in our private schools finally, as well as our public schools. This bill will bring equity to Virginia's academic offerings for students with disabilities. I ask your support, and I'm happy to answer any questions.
Thank you, Delegate. Are there any questions or comments from members on the floor? Is there anyone that wishes to speak in favor of the bill?
First, we have Michael Assip. He's being moved into the room, Madam Chair.
Thank you. Please go ahead.
Michael, please unmute and go ahead whenever you're ready.
My apologies. Thank you, Madam Chair and Delegate Corey. VCASE supports the bill that provides for licensure requirements for private education schools serving our students with disabilities. Thank you.
Thank you.
Leslie Sale.
Good afternoon, Madam Chair and members of the committee. My name is Leslie Sale. I'm here on behalf of the Department of Education as their Director of Policy. First, just want to extend another thank you to Delegate Corey for carrying this bill for us. And as Delegate Corey articulated in her presentation, we felt like accreditation would be an important component and meaningful addition to the quality assurance metrics that go into the Board of Education's licensure process for these private schools that serve our students with disabilities. And appreciate your consideration of the bill. Thank you.
Grace Creasy.
Good afternoon, Madam Chair and members of the committee. My name is Grace Creasy. I'm the Executive Director of the Virginia Council for Private Education. We want to thank Delegate Corey for bringing this bill forward. Our mission at the Virginia Council for Private Education is to advance accreditation in the Commonwealth of Virginia. And I'm really just here in case the committee has any questions.
Shane Riddle.
Madam Chair, committee members, this is Shane Riddle with the VEA. The VEA supports this bill. Thank you.
Madam Chair, there are no other hands raised.
Just checking one more time. Is there anyone that wishes to speak in opposition to the bill? Please raise your hand. Seeing none, is there a motion on the floor?
Move to recommend reporting.
It's been recommended that we report the bill and seconded. Let's do a roll call vote.
Senator Howell?
Aye.
Senator Locke? Senator Donovan? Senator Peake by proxy? Senator Hashmi?
Aye.
Ayes 5, no 0.
Thank you. Delegate Corey, your bill is reported.
Thank you very much, Chairwoman.
Thank you. And I just want to apologize to the patrons that have been waiting patiently, and I'm sorry we've had to shuffle the schedule just a bit, but we will revert back to the original schedule. And so the next bill is HB 2019, and I understand there is a substitute. Is that correct? Are we ready with that substitute?
Madam Chair, the substitute's available on LIS.
Thank you. And if Delegate McQuinn is ready to speak, we'll hear from the delegate.
Yes, ma'am, Madam Chair, I'm here, back.
Thank you. Please go ahead.
Thank you, Madam Chair. Madam Chair, House Bill 20.
We need to move the substitute first.
Yes. Madam Chair, before I begin, I have a substitute I'd like to report.
It's been moved and seconded. All in favor? Aye. Any opposed? The substitute is now in front of us. Please go ahead, Delegate.
Thank you, Madam Chair. Madam Chair, the substitute does the following. It delayed the enactment of this bill to January 1, 2022. Secondly, it ensured the work group creating these policies have a deadline of September the 30th, 2021. And then finally, it revised the enactment clause to create model policies that will be included in DOE asthma maintenance guideline. This was also required DOE to be the lead in developing model policies in collaboration with VDH. These changes have come about as a result of extensive talk that we had from various entities that are involved and engaged in education. And we believe these delayed dates will give everyone the time they need to ensure provision in this bill as it is rolled out in a timely and efficient fashion. So, Madam Chair, that is the enactment, that is the substitute. But what the bill does, the bill is require all public schools to stock albuterol in the event of an emergency for treating students experiencing asthma attack. Asthma seems to be a growing problem in the school systems, and even across this country, 6.1 million children suffer from asthma, which is the leading chronic disease among the pediatric population. And as of 2016, more than 129,000 Virginia children were reported to live with this condition. And we find that now, and there are pediatricians and others who are on the line, but we also have a rising number of kids who would additionally be diagnosed with asthma as a result of COVID-19. And so, Madam Chair, this is, again, a growing problem. I think that it is something that we can have a solution for because precedent has already been set. All about is just establishing the protocol under these circumstances and making sure that our children are protected from every aspect that we could provide. So, Madam Chair, I hope it would be the pleasure of the committee to report the bill. Thank you, Madam Chair.
Thank you, Delegate. Are there any questions or comments from the members on the floor? Is there anyone that wishes to speak in support of the bill? And that's HB 2019.
Lauren Schmidt, please go ahead.
Good afternoon, Madam Chair and members of the subcommittee. Lauren Schmidt speaking on behalf of Children's National Hospital and the Virginia chapter of the American Academy of Pediatrics. We strongly support the bill. I just wanted to address a few things that have come up. As Delegate McQuinn said, this is modeled after the legislation passed in 2012 for EpiPens. So the structure for this type of policy is already in place, and this is not new territory. And I also want to just be clear that the code already allows any school board employee who is trained to administer albuterol. So it does not have to be a nurse. If a school does not have a school nurse, they would simply train the same person who currently is trained in the administration of epinephrine. I've also heard the schools say that this is a lot to ask them to take on during COVID. And that's why Delegate McQuinn has added the delayed enactment in there to give them plenty of time to adapt to this. And I would also say that, COVID right now makes this legislation even more critical. As you heard, we're seeing more and more children be prescribed inhalers after experiencing COVID. So it's absolutely timely and relevant. And so we ask that you put the health and well-being of the children in the schools first and vote in support of this bill. Thank you.
Eduardo Fox, please unmute and go ahead.
Good afternoon. Thank you for the opportunity, Madam Chair, to speak to you and to the committee. My name is Eduardo Fox, and I'm a pediatrician, and I work with the Impact DC Asthma Clinic at Children's National Hospital. I frequently see children who don't have access to a rescue inhaler at school, and as a result, suffer worse asthma flares, end up in the ER, and or get admitted to the hospital, and miss a lot of school time. Albuterol is the most commonly used rescue medication for asthma. It is very effective with quick onset. It is important to note that HB 2019 addresses rescue inhalers only and not daily or controller medications. Asthma disproportionately affects communities of color, children and families with lower health literacy, and those who lack access to consistent healthcare. Stock albuterol at school ensures that all children will have access to albuterol in case of an asthma exacerbation. It is a vital step in making our schools safer for children with asthma. Giving albuterol earlier in an asthma attack prevents symptoms from becoming more severe and potentially dangerous. I strongly encourage members of the committee to support HB 2019. Thank you very much for your attention. I'm happy to answer any questions.
Madam Chair, we have 3 more speakers. Next is Carter Beatty.
Thank you, Madam Chair. Carter Beatty with Children's National Hospital. I would just associate myself with the comments of Dr. Fox and Ms. Schmidt and thank the delegate for putting in the bill.
Tom Smith, please unmute and go ahead.
Madam Chair, I've got some concerns with the bill, so I'll let others go first, please.
Shane, whenever you're ready.
Thank you, Madam Chair. The VEA and the Legislative Committee with the VEA has taken a position to support HB 2019. Thank you.
Madam Chair, there are no other hands raised in support of the bill.
Thank you. Are there any who wish to speak in opposition? I know Dr. Smith is on the line, and anyone else who wishes to, please raise your hand. And Dr. Smith, please go ahead.
Madam Chair, members of the subcommittee, Tom Smith with the Superintendent's Association. Our main concern with this bill, while we have concerns about what it is asking schools to do, we heard from Delegate Adams that today that only registered nurses should be involved in the care of young people with asthma in schools, and so we're a little concerned about some uncertainties there when our schools may not have a nurse in place. But we do appreciate the delegate involving the Department of Health and the Department of Education in dividing the guidelines. And so we're very appreciative of that. And we look forward to working with that. Our main concern is the enactment date right now. The enactment date for schools would be January 1. This is, and for the Health Department and the Board of Education, we would not get their findings until September 30. That's only 3 months. And you got to remember also that this summer and next fall are going to be very, very difficult times for schools and the health department in getting schools open, the uncertainties that are out there and dealing with that. That's why we had requested that the enactment date for schools, the beginning date, be July 1, 2022. And that would be our concern and our desire. Thank you very much.
Stacey Haney.
Hi, Madam Chair, members of the subcommittee, Stacey Haney on behalf of the Virginia School Boards Association again. First, I'd like to express my appreciation to the delegate and her team for seeking our input and for the changes that were made today, as well as some amendments that were made early on in the process. And we really appreciate the efforts that have been made to address our concerns. Unfortunately, we're not 100% of the way there. And so I do have to just raise the concerns that we have remaining. As Dr. Smith said, we heard earlier from Delegate Adams that a registered nurse is really the only person who should be responding to these events and administering this medication. Yet we know that we don't have registered nurses in all of our buildings right now. And so that's a concern that we've heard from some of our staff. And then the other concern I'll just raise is that I understand the delegates put in a budget amendment, and we certainly appreciate that. But my understanding is that that was calculated to provide one inhaler and one spacer per school. So our concern at any time, but certainly during times of COVID, is sharing an inhaler and a spacer between multiple students. Obviously, I think folks would have concerns with that. And so I'm concerned that the amount of the budget amendment won't cover the entire cost. We're certainly grateful to get any help we can with the cost. And so that's just another concern that it's going to cost more than what's been calculated here. But again, we appreciate Delegate McQuinn's efforts to work with us and look forward to continuing to work with her if there are additional tweaks that could be made to make this more workable. And so we thank the delegate very much and just wanted to share our continued concerns. Thank you, Madam Chairman, delegate, members of the subcommittee.
Madam Chair, there are no other speakers in the queue.
Thank you. And I just want to clarify one point that was made by our last two speakers. If I'm reading Delegate Adams' bill correctly, that's HB 1736, which we just recommended for reporting out of this subcommittee. That bill actually does not put us in conflict with the bill that we have in front of us. Delegate Adams' bill reads that no individual who provides nursing services in a public elementary or secondary school shall use the title of school nurse unless that individual is a registered nurse. So that does not prevent other individuals from assisting a student who may have a need for the albuterol or assistance with an asthmatic attack, if I'm reading that bill correctly. Are there any other questions or comments from the members on the floor?
Madam Chairman.
Yes, please go ahead, Senator.
And I'm sorry that Madam Chairman of Finance is not here, although I know in spirit she agrees with me. At some point in time, we are going to have to make a conscious decision about the expectations we have for schools and the bills that we're passing. Because there is ironic conflict in a lot of these bills. And I believe what Delegate Adams said was that registered nurses are the only that are indicated to provide those kind of medications and respond, and maybe she said something about escalating the evaluation. But we are throwing a lot at schools, and don't misunderstand me. I think we ought to have health care in schools, but we're asking schools to do that without giving them the resources to provide health care. Make no mistake, I mean, administering medications, we are making carve-outs and saying somebody trained to do it can do it, but at the same time, we are asking schools to perform in a new space without us redesigning schools. And I think that if we want this to be done in a quality way, there's liability for the individual, just emotional liability. If a teacher is trained to do this and it doesn't go right, I feel badly for that teacher. You know, this is a small deal when you look at them one-offs, but when you look comprehensively about what we're asking schools to do, if we want health care, we need to put health care into the schools, and that means funding a registered nurse for every school, and it means setting those expectations and giving guidelines and linking them to physicians and other medical supports. But I just need to say that because when we talk about walking in somebody else's shoes, I think we can all empathize with what the educators are being faced with, and it's a full assault. And I hope we'll take that into consideration as we move forward.
Thank you, Senator. Are there any other comments? Is there a motion on the floor? Second. It's been moved and seconded to recommend reporting. Let's do a roll call.
Senator Locke? Senator Donovan? Senator Peake by proxy? Senator Hashmi?
Aye.
Ayes 3, noes 1.
Thank you, and thank you, Delegate McQuinn. The bill is reported.
Thank you so much, Madam Chair and the committee. Thank you. Have a great evening.
Thank you. You too.
Mm-hmm. Bye-bye.
Our next bill is HB 2027, patroned by Delegate Coiner, and it's my understanding after I look at the bill that it is similar but not identical to SB 1357, which is Senator Donovan's bill. Delegate Coiner, would you like to speak to the bill?
Yes, Madam Chair, thank you.
Please go ahead.
Thank you, Madam Chair. HB 2027 is the mechanism by which we shift 3rd through 8th grade reading and mathematics high stakes SOL tests to through-year growth-based assessments. First, House Bill 2027 addresses COVID-related learning loss. It will give teachers and school officials immediate assessment tools to identify and address these learning gaps accurately and quickly. Second, House Bill 2027 provides high-quality growth assessments for all of Virginia's students. Currently, wealthier districts purchase high-quality growth assessment tools, while lower-income districts work with lower-quality tools or none at all. Inevitably, this difference unfairly affects low-income and minority students. House Bill 2027 will ameliorate this inequity. Third, House Bill 2027 will provide better data on student needs and student performance than the data we currently have. It will expand the scope of current testing to see how far below or above grade level a student stands, not merely whether a student is at or below grade level. This improved data will allow teachers to shape individualized instruction who are struggling. School officials, lawmakers, and appropriators will be better informed to channel resources where they are most needed. I'd like to thank the UVA Law Clinic under the direction of Professor Andy Block and 2 law students who helped with this research and to bring this bill forward, Juliet Busig and Tim Shriver, and they are here as experts to assist if you have any questions as well.
Thank you. Before we hear any testimony on the bill, Senator Donovan, did you want to speak to this bill, and did you want to move to conform it to SB 1357?
Madam Chairman, the bills are incredibly similar, and the patron and I have been conversing. At this time, I will not move to conform hers, but she knows we may change that as it goes to the floor. So it kind of depends upon the position of the House on my bill when it goes over. But thank you for asking me, Madam Chairman.
Thank you, Senator. Are there any folks who wish to speak in support of the bill?
We have 3 speakers, Madam Chair. First is Timothy Shriver.
Good afternoon, Madam Chair and members of the committee. My name is Timothy Shriver, and I am a law student at the University of Virginia, working under the supervision of Professor Andrew Block as part of the State and Local Government Policy Clinic here. I had the privilege of working with Delegate Coyner in the research and drafting of HB 2027. My views here are expressed are just my own, not of the law school or UVA. And I'm just here to answer any questions about some of the background work we did, the researching at the specifics of it, and to express our support for the bill and to ask your support for the bill as well. So thank you.
Lori McCullough.
Good afternoon, Madam Chair, members of the subcommittee. My name is Laurie McCullough. I'm the Executive Director of Virginia ASCD, which is a group of about 1,500 teachers, administrators, and teacher educators. And I also had the privilege of serving as a member of the SOL Innovation Committee. Both that committee and my association have advocated consistently for an assessment system that is more modern, more balanced, and more focused on student growth than the system we currently have. We think that valid measures of growth are especially important in the elementary and middle school grades in science and, in mathematics and reading, where students progress along a continuum of skills that lay the foundation for their future learning. So we think this bill targets the right emphasis at the right grade levels. And in addition, we certainly look forward to shorter, more computer adaptive assessments in the fall and spring rather than one great big lengthy high stakes test annually. We think it will be less disruptive to instruction. We certainly have aspirations for an even better assessment system in the future, but we appreciate Delegate Coyner involving us, welcoming our feedback on the bill, and we think it's a huge step in the right direction. Thank you for letting me speak.
Shane, please go ahead.
Madam Chair, committee members, this is Shane Riddle with the VEA. We really believe this alternative approach weaves assessment into teaching itself. And we will also believe that it's especially important for students with disabilities, English language learners, and at-risk students. It flows into multiple measures to show the student growth, which is more appropriate. It's a more appropriate way to determine how well students are doing and the progress that they're making and the progress that they've made. So we really encourage the committee to move this bill forward, HB 2027. Thank you so much.
J.T. Kessler.
Good afternoon, Madam Chair, members of the committee. J.T. Kessler on behalf of the Virginia School Boards Association. I want to echo the comments that my colleagues have made and thank Delegate Coyner for starting us on this positive step forward when it comes to reforming SOL testing, moving from high stakes to growth assessments. Thank you so much.
And lastly is Tom Smith once again. Madam Chair, Tom Smith is being moved into the room right now. I think his connection is a little slow.
Thank you. While we're waiting for Mr. Smith, are there any comments or questions from members on the floor? Senator Donovan, this bill will come before the committee next Thursday, the full committee, and I think it would be wonderful if you and the delegate are able to reach some consensus on the language of the bill so that we have agreement.
We will, Madam Chairman. Thank you. And I'll tell you the big difference is, I'm sorry I was doing the two committee thing for a minute ago when I spoke, but a couple of the differences are I have 2 diagnostic tests and 1 progress test, which I prefer because I think it gives us 2 chances to remediate. And the other difference is that I have some K-2 assessments. Eventually, the Department of Education, who's already working on this project, is going to be able to assess kids in 1 grade level, but also assess if they are 1 grade level behind or 1 grade level ahead. So they'll be able to have that better scope of understanding so that as we assess our kids, the assessment alone is not the only value that they have because they then use that to apply to analysis of how a child is progressing. And that's what we really all want to get to, so that we know that the child is progressing on the trajectory. And so I'm excited that we're moving forward. We've been able to make progress with CARES Act money. It's going to take an investment in the future. But there's a lot of alignment, and we will have made a final decision by next week.
That'll be wonderful. Thank you. If Mr. Smith is not able to come into the room, let's go ahead and see if there's a motion on the floor. It's been recommended reporting and seconded, and let's go to a roll call vote.
Senator Locke, Senator Donovan, Senator Peake by proxy, Senator Hashmi.
Aye.
Ayes 4, no 0.
Thank you. Delegate, your bill has been recommended for reporting.
Thank you, Madam Chair.
And the next bill is HB 2176, Delegate Torian. Is Delegate Torian with us?
Yes, Madam
Yes,
Chair.
Madam.
please
Yes,
intervene.
yes, I'm here.
Thank you, Delegate. Please go ahead.
Thank you, Madam Chair. Madam Chair, House Bill 2176 will help promote a healthy work environment for all our teachers and all of our school board employees. Existing law requires school boards to educate their employees about bullying and adopt policies to prohibit abusive work environments, discipline employees who contribute to an abusive work environment, and prevent retaliation against employees who speak out regarding abusive work environments. 2176 simply is a clarifying bill that defines for the purpose of mandatory school board policies related to abusive work environment the terms abusive conduct, abusive work environment, physical harm, and psychological harm. Madam Chair, this bill has the support of the Virginia Education Association.
Thank you, Delegate. Are there any questions or comments from the members? Is there anyone in the public who wishes to speak in favor of the bill?
Madam Chair, we just have Shane Riddle in the queue.
Thank you, Shane. Please go ahead.
Thank you, Madam Chair. We just want to reiterate our support for Delegate Torian's 2176. We believe that this really does add clarity to 3 good terms on the policies that school boards must adopt in regards to abusive work environments and things like that. And so we appreciate the committee's favorable passage.
Thank you. Are there any individuals who wish to speak in opposition to the bill?
There are no hands raised.
Thank you. Seeing none, is there a motion on the floor?
Madam Chairman, question first for council.
Please go ahead, Senator.
Are these definitions that have been used elsewhere in the code that we are now applying to this code section, or are these new definitions that have been written?
Madam Chair, Senator Donovan, my understanding is that these are new definitions that were written, but Delegate Torian might also wish to comment.
Delegate,
No.
did you hear the question?
Yes, Madam Chair, I did. These are as I understand them, new definitions.
Senator, do you have additional questions?
No, ma'am. Thank you.
It's been recommended for reporting and seconded. Let's do a roll call vote.
Senator Locke, Senator Donovan, Senator Peake by proxy, Senator Hashmi.
Aye.
Ayes 2, no 0, abstentions 2.
Delegate, the bill is recommended for reporting. Thank you very much.
Thank you, Madam Chair.
Next, we are down to our last two. It's been a long docket. Thank you to everyone for your patience. The next bill is HB 2299. Delegate Carr.
Thank you, Madam Chairman. HB 2299 implements several recommendations from JLARC's 2020 study of K-12 special education services. JLARC made these recommendations in order to improve the quality of special education students' IEPs, school divisions' attention to helping these students plan for life after high school, and to address the long-standing special education teacher shortage. HB 2299 will require the Virginia Department of Education to develop a robust training on IEP development and school personnel who develop IEPs to take the training at regular intervals, to annually conduct a structured review of a sample of IEPs to evaluate school divisions' compliance with IEP development standards, and to notify superintendents, school board chairs, and others of needed corrective actions, to communicate any identified problems to the school division and ensure that they are corrected by the end of the school year, to design a robust plan for how it is going to move proactively oversee and assist school divisions over the long term in their efforts to help students with disabilities plan for life after high school, and to develop and maintain a strategic plan for recruiting and retaining special education teachers. Finally, to update this committee on its progress on these tasks. Madam Chairman, when JLARC staff presented this report to the commission in December, Superintendent Lane committed that the department would address the shortcomings identified in the report, and this bill will give the department the direction and authority it needs to do that. Madam Chairman, Drew Dickinson from JLARC is here to provide any additional information.
Thank you, Delegate. And I should have clarified at the start that this HB 2299 is similar to our Senate bill, SB 1288, and that was patroned by Senator Donovan. Senator Donovan, did you want to address the differences that might exist between these two bills?
Yes, Madam Chairman, I'm getting an email to that specifically, but yes, the bill that is being presented by Delegate Carr leaves out recommendations from the JLARC review that mine includes. And I did put that to a review. The explanation I've gotten from people who have asked me to amend my bill, and we may hear them when they're on, so perhaps they would want to speak to that. But there was a robust conversation with JLARC in the process of the JLARC review that VDOE had the opportunity to interject in, and during that entire process, there was no concern about the ability to implement all of these recommendations. And the opinion against the aspects of my bill are that VDOE has already started some things, and it would be inconvenient for them to implement the JLARC recommendations over what they've started. However, that was not discussed during the whole process, and JLARC feels very strongly that these bills will significantly improve the outcome for IEP, and I can try and get you those specific lines. It's mostly referring to lines 508 to 585 in the Senate substitute.
Thank you, Senator. And I imagine we're going to hear perhaps from our external speakers about some of the distinctions between these two bills. Is there anyone who wishes to speak in support of HB 2299?
Drew Dickinson.
Thank you, Madam Chair and members of the committee. My name is Drew Dickinson. I was the project leader for JLARC's review of K-12 special education in Virginia. And I'd like to thank Delegate Carr for taking up some of the important recommendations from our report and putting them in this bill. We really appreciate it. And Delegate Carr summarized the key provisions of this bill. And so I just want to just make sure everybody knows that this bill would implement some really important recommendations from our report.
Candace Lucas. Candace, please unmute and go ahead.
Okay, my name is Candace Lucas, and I'm speaking in favor of the bill. I am an advocate that works with primarily families of color and low-income families, and we are finding one of the greatest challenges that our families are facing is that the school division's staff is not properly trained on how to implement the provisions of the IDEA, and I wanted to just share that. I am a licensed educator and administrator through the Virginia Department of Education, and I know that I had to seek outside resources in order to be able to write and author IEPs with fidelity, to know how to interact with families to ensure that their voices are heard through the special education process, as well as being able to comply with the provisions of the IDEA to ensure that the IEPs are individualized. I know based on experience, having worked for Henrico County Public Schools, that training is not provided to either administrators, educators, or parents, who are the key individuals required in order to properly collaborate to develop the individualized educational plan. You would not send a foot doctor to do brain surgery. So why are we sending professionals who are not prepared to develop IEPs when they don't know how? And that is a huge issue. And I welcome the opportunity to have advocates, parents, administrators, everyone certified to serve on IEP teams, understanding that IDEA is a civil rights law that has to be upheld in order to meet the needs of kids. And you have to learn the policies and the guidelines in order to comply. So I'm in full favor of this bill, as I was with Senator Donovan's bill. Thank you.
Michael Assip.
Good afternoon, Madam Chair and members of the subcommittee. Mike Asip, and I speak on behalf of the Virginia Council of Administrators of Special Education, representing over 400 members who provide and supervise the services for over 165,000 students with disabilities across Virginia. We want to thank Delegate Carr for submitting this bill and supporting 6 of the JLARC recommendations in this bill, and we look forward to working with the Department of Education to implementing changes that support improvement of training and improvement of services for students with disabilities. A few of the items that we wanted to share, and this bill is a much more concise version, which we are pleased with in terms of looking at those recommendations and moving forward with clear enactment clauses. So I think the work we've recommended, the work is already getting done by the Department of Education, and localities need to do that. Funding is a big concern that JLARC does not support any additional funding for these ideas for implementation, the recommendations of JLARC. The localities are bearing 70% of the burden of costs in special education, so we support additional funding that the localities can receive to support the compliance requirements of the JLARC study. In addition, the teacher shortage, as we talked about, as we've heard before, there are teachers, and having trained a cohort of teachers, 22 of them, 2 of them said that they were equipped to write and chair an IEP meeting. So we agree that our teachers, especially with the teacher shortage that we're facing now, it's critical, and that is affecting a lot of the inconsistencies among IEP quality that was pointed out in the JLARC study. So addressing this critical shortage is in this bill. We fully support that. And we fully support the training of general ed teachers and general ed administrators who lead those meetings, who participate in those meetings. They need to know more. They need to have more than a module. They need to have ongoing training that supports implementation of regulations in the most highly regulated component of education in the Commonwealth. Thank you very much. Appreciate working with Delegate Carr and Senator Donovan moving forward.
Madam Chair, there are 3 remaining speakers. Tracy Smith, whenever you're ready.
Thank you, Madam Chair, members of the subcommittee. Tracy Smith, I worked with Drew and his team on our study. I'm from JLARC. I worked with Drew and his team on our study of special education last year. And I'd like to thank Delegate Carr for taking up these recommendations, as well as Senator Donovan in her legislation. Just one point of clarification to Mr. Asap's resources. The JLARC report, it is not at all that we don't support additional funding for VDOE or for the local school divisions to implement our recommendations. In fact, in the last section of our report, we do recognize that the department may in fact need additional resources to go forward and implement the many recommendations that we issued in our report. We do believe that that particular division of the department has a sizable staff, and we do feel that the first step is for the department to potentially identify ways that existing resources could be used first to implement the recommendations. So I just wanted to clarify that the JLARC has not said that additional resources are not.
Thank you for that clarification. I understand that we have 2 more speakers. We have run overtime, so I'm just asking that I'm asking that our remaining speakers please limit their comments. Thank you.
Terry Morgan.
Hello, Madam Chair and members of the committee. I'm Terry Morgan, the Executive Director of the Virginia Board for People with Disabilities, and the board supports implementing the JLARC recommendations in this bill, including the increased training in IEPs and monitoring of IEP sections, particularly around transition. We thank you, Delegate Carr, for carrying this bill. Thank you.
Madam Chair, the final speaker is Stacey Haney.
Madam Chair, Stacey Haney again on behalf of the Virginia School Boards Association. I want to primarily speak to the difference between this bill and Senator Donovan's bill. Delegate Carr's bill, as Dr. Asap said, it's more streamlined, but it still fully implements, by my count, 7 of JLARC's recommendations. And so we believe that Delegate Carr's bill is the vehicle that we would hope moves forward. That's not to say that the remaining JLARC recommendations shouldn't be addressed, but we think that from implementing, and prior speaker spoke with regard to the Department of Education's ability to implement this, but we're looking at this from local school boards' ability to implement JLARC recommendations. And so we believe that the 7 recommendations that are in Delegate Carr's bill, that's the right first step, right first 7 steps forward. And the remaining JLARC recommendations, I think, require some additional time and work. And so we're, again, not to say that we're not committed to working towards those other recommendations that are in Senator Donovan's bill, but we believe that Delegate Carr's bill is the bill that should move forward at this time, this session. Thank you, Madam Chair.
Thank you, Ms. Haney. I understand there are no more speakers in queue. Are there any comments or additional questions? And
Madam Chairman.
Senator Donovan, please go ahead.
Thank you, Madam Chairman. I want to point out that this past summer, there was a federal decision that Virginia was severely lacking in oversight of their IEPs, and we are in jeopardy if we do not make the changes to our IEP process of actually not being compliant with federal law. I will additionally point out that the recommendations from JLARC are well thought out with input from all of the stakeholders, and I know this is inconvenient. I know it's hard to make the changes, but what has happened to our children in Virginia is that have special education is profoundly alarming. Additionally, there's money in the Senate budget to address this issue because we know that there is a comprehensive reform. And so as a result, Madam Chairman, I would like to move that we conform Delegate Carr's bill to my bill, as I am sure mine will be conformed to hers in the House, and it will allow us an ongoing conversation to make these final decisions.
There is a motion on the floor to conform HB 2299 to SB 1288. Is there a second? It's been moved and seconded. Let's do a roll call on, I'm sorry, who's in favor of this confirmation, please say aye. Any opposed? I couldn't hear if there were any opposed.
Madam Chairman?
Yes, Delegate.
I was just going to add that there's some money in the House budget also to help implement the recommendations. And I believe that, I think maybe Drew maybe would have one other statement you wanted to make.
Delegate, I'm very sorry. I'm having difficulty understanding you. Would you be able to please repeat what you were saying?
Yes, thank you. I have, I just wanted to note also that the House budget contains money to help implement the recommendations. And I believe that Drew would also had one other comment to make, Mr. Dickinson.
Madam Chair.
Yes.
Just really quickly, I just want to clarify that the two bills can work well together. They're the language is very similar, if not identical, between the two bills, and so I don't think there's conflict between. And I also want to clarify that Senator Dunavant's bill does address many of the recommendations that we have in the report, and it's not just clarifying. It's very important changes that we feel need to be made, and so I just wanted to make sure that it's known that these are two bills that can work together, and they also would comprehensively address many of the issues that we identified in our report. Thank you, Madam Chair.
Thank you very much. There's been a motion, and it's been seconded to conform HB 2299 to SB 1288. Let's just repeat the vote on that. All in favor, say aye. Aye. Any opposed? Hearing none, the bill is conformed, and with the understanding that there will likely be a conference committee. And let's do a roll call vote on the new substitute then.
Madam Chair, are we moving to recommend to report, or?
I'm sorry. Move to, yes, we have a recommendation to report with the substitute now.
Senator Locke? Senator Dunavant? Senator Peake? Senator Hashmi?
Aye.
Ayes 4, no 0.
Thank you, Delegate Carr. The bill has been recommended for reporting with the substitute.
Thank you, Madam Chairman, members of the committee.
Thank you. And our final bill, last but not least, is presented by one of our newest delegates. So welcome, Delegate King. This is HB 2316. Please go ahead.
Thank you, Madam Chair and members of the committee. House Bill 2316 relates to our 164,000 students with special needs in the Commonwealth. And this would require the Department of Education to update its special education eligibility worksheets to address any ambiguity or vagueness in eligibility criteria and provide appropriate guidance to local school divisions. It would also require the Board of Education to ensure that each graduate of a K-12 general education endorsement area understands the role of general education teachers in the development of the IEP. This is important because we currently don't have any codified eligibility guidelines for special needs education. It's created an inequitable system wherein students are referred for special education but not receiving consistent services in different communities. This is something I've personally experienced as the mother of a child on the autism spectrum and moving from one school division to another, seeing that things are very different. It is something that impacts many families in this Commonwealth, and this is a bill hoping to be one step in the right direction along with some of the other great work that this committee is doing. I'm happy to answer any questions that the committee may have, and I believe there may be some supporters here as well.
Thank you, Delegate. Are there any questions or comments from the members on the floor? Seeing none, are there any speakers who wish to speak in support of the bill?
Madam Chair, we have two hands raised. First is Michael Asip.
Good afternoon again, Madam Chair and members of the subcommittee. VK supports this effort. There are clear criteria already in regulation, but to facilitate any further understanding that parents can have in terms of eligibility requirements and procedures, we do need to be consistent across divisions as best as we can, and that needs to happen to be equitable for all students with disabilities. So we support the bill. Thank you, Delegate King.
Madam Chair, there are actually 3 speakers who just raised their hands that I moved to the queue. Next is Candace.
Good afternoon, Madam Chair and committee members. Once again, my name is Candace Lucas. I'm with Advocates for Justice. We serve primarily families of color, families with that speak English as a second language, as well as families that are economically disadvantaged in order to access academic justice through special education. We are in support of Delegate King's bill, full support primarily because, as she stated, the eligibility forms that the VDOE presently uses are outdated and very subjective in their nature. We've identified situations in which cultural barriers have been misinterpreted and students have been misidentified as having intellectual disabilities just because their IQ score was a certain amount and they had more than sufficient adaptive behavior scores to disqualify them from being intellectually disabled. We also had concerns regarding the overuse of emotional disturbance for Black male students and funneling them through the school to prison pipeline as a result of subjective activity or subjective perceptions of individuals who do not know what they're doing. And I'm speaking as an educator and a licensed administrator as well. Finally, we definitely want to make sure that our families are educated regarding what the eligibility process is, and the eligibility forms are clear and concise. There is nothing left up to subjectivity, and that cultural as well as adverse impact within the school setting is properly determined so that we're not placing students in overrepresented areas such as emotional disability or any type of intellectual disability because of cultural issues or speaking English as a second language. And the final thing I want to state is that the eligibility forms do not have a place for English, for our parents, our families that speak English as a second language, which is vital when you're considering eligibility. And we have to fight with school divisions for them to even consider English as a second language as a factor they may eliminate misclassifications as far as disabilities are concerned. So those are major issues, and I'm truly appreciative to Delegate King as an educator, a special educator, as an advocate, and as a mother for her bill. Thank you.
Tracy Smith.
Thank you, Madam Chair. Tracy Smith, again, from JLARC, and just wanted to say that this legislation would represent one of JLARC's recommendations from last year, and just wanted to thank the delegate.
And finally, Drew Dickinson.
I also want to thank Delegate King. This would implement, address some of the key issues we found about just variations in the proportion of kids who were found eligible for special education, and are finding that some of that really comes from just a inconsistent interpretation and application of eligibility criteria. And I think that's a really important just clarification that we feel like the Department of Education can help with.
Thank you. Are there any who wish to speak in opposition to the bill? Seeing none, is there any comment from members on the floor? Is there a motion on the floor? It's been recommended to report and second. Let's do a roll call vote.
Senator Locke, Senator Donovan, Senator Peake, Senator Hashmi.
Aye.
Ayes 4, no 0.
Thank you, Delegate King. Your bill has been recommended for reporting.
Thank you, Madam Chair and members of the committee. Have a great evening.
Thank you. And I'll just ask staff, does that complete our docket? There's no more?
Madam, that completes the docket.
Thank you so much. The committee will rise. Thank you for your hard work today.